Hello and welcome to Bottom Line. I'm Cindy Keynes. We have an excellent show for you today. We're going to understand more on what is a chiropractor and what might be some times and situations in which you might want to see one. I'd like to introduce my guest for today's show, Dr. Alex Rodnick. Welcome to the show.
Thanks for having me, Cindy.
Well, as I was saying to the audience at the beginning, what is a chiropractor? If you had to give a definition.
Well, a chiropractor is a doctor who focuses on the spine and nervous system, more in relationship into how the body is able to heal from within. Your brain and spinal cord regulate and organize every aspect of your body and all of its functions, and there can be interferences with how that process goes by having misalignments in the spine that are going to irritate the nerves.
Right.
Right, and we all probably, I'm not even sure what the stats is, but it seems like a majority of people are going to have some issue with their back, let's say, where they have lower back pain and it bothers them, or, as we get older and so on. If someone starts feeling some lower back pain, it doesn't seem to want to go away. What is it something that maybe they'd come see you for, and what would they expect?
Absolutely. Many people seek chiropractic for lower back pain as well as many other issues. And like you were saying earlier, about 70% of people throughout their lifetime will have at least one episode of acute lower back pain, which can be debilitating. It can take you out of work. And as a chiropractor, I see this every day, and we really do get very good results with that. And several studies have compared chiropractic alone versus chiropractic with medicine, and they found that just by adding in chiropractic, you're able to get better faster and also at less cost to your insurance company.
And when you talk about, maybe we can talk a little bit about kind of training and education for a chiropractor, because some people may not understand if they're a doctor or not a doctor, or what kind of training have they had. So what might be something that you're required to get and that people can look into?
So chiropractic, it's like any graduate program. You have your undergraduate schooling first, so you would get a bachelor's degree or equivalent as far as credits, and then you would enter into a chiropractic program. Now it's a limited license physician classification, so it's similar to a podiatrist or a dentist or something along those lines, where it's not a medical doctor. So it's first you do like 4 years of undergraduate, you get a bachelor's degree, and then you enter into the graduate program, which, depending where you go to school, is about 3.5 to 4 years, in which you go through all basic sciences, anatomy, physiology, histology, pathology, microbiology, anything that ends with ology. We get all those classes, and then there's an advanced clinical studies too, where we'll not only learn chiropractic adjusting techniques, but the orthopedic and neurological examinations, x-ray analysis, advanced imaging, things like that.
Okay. Now, if someone comes in and they say to you, gosh, Dr. Rodnick, I kind of slipped, I fell, and my lower back doesn't feel right. I've tried, maybe some aspirin or ibuprofen, and it's still really bothering me, so could you help me? How might you, and I know you brought some things along here too with us to kind of walk through, what might they expect in their first consultation with a chiropractor?
Okay. So initially, when in my office, what we would do is first we would go through and do a comprehensive examination. We're going to go through, check all their range of motions. We're going to do orthopedic, neurological testing, possibly thermography, and decide whether or not we needed to take x-rays. And then usually I'll come in and do a little consultation, see what's been going on, and of course we take a history and find out what caused this. Sometimes people don't know. They say, I don't know, I just woke up, it's killing me. Other times they say, oh, I got hit by a car and now everything hurts. So that's always gives us a good idea about what's going on. And then if we do take x-rays, we're looking at not just for fractures or dislocations, but we're actually looking at the alignment of the vertebra. And even minor misalignments can cause an occlusion or a closing up of the holes where the nerves come out from the spine. And when that happens, it can pinch and irritate the nerves, and when that happens, it can cause a whole array of symptoms.
So when that happens, can you show kind of when you're on one of your models here a little bit about our spine? Some people haven't seen something like this before.
So here's a model of the spine. Your skull's up here, your tailbone's down here. Now, a couple of things we want to look at when we're looking at the spine. From when we take an x-ray, we do two different views. We do one view looking at it from the back and one view looking at it from the side. Now the side view in a normal healthy spine, you should have 3 normal curves like this. So your neck should curve back, upper back should curve back like that, and then your lower back should curve. And the reason we have these curves is for several different reasons. For one, it makes our spine structurally stronger. It makes it more stable. Just like when they build bridges, they have an arch shape because it is able to handle more load. Now another reason is where these joints line up, the facet joints, they kind of sit on top of one another at a nice little angle like that. Now if we were to lose that curve, let's say it's straightened out or reversed, which we see oftentimes with a whiplash injury. Now instead of those joints lining up like this, they line up like this. So instead of moving nice and smooth, they rub. Now when you leave it in that position for a long enough time, then we start to have bone spurs and disc degeneration. It's basically what is degenerative arthritis. It's just wear and tear, and our joints start to wear out. And I have a couple models here. If I can grab the right one. So this is a normal, healthy motion segment. So we've got the 2 vertebrae, the spinal cord in the middle, and the nerves coming out on the sides, and the disc in the middle. Now
nice healthy disc.
That's a nice healthy disc. This is one with degenerative disc disease, bone spur formation. This is arthritis in the spine. And that's what can happen having misalignments long term. So it's kind of like having the alignment in your car. If the axles are out of alignment, your tires wear out faster. Well, if your spine or if your joints are not lined up properly, over time those joints wear out faster than they should. Okay. Now, continuing on, the last reason we have these curves in our neck is it allows for slack for our spinal cord. Our spinal cord is actually anchored in at the skull and throughout the spine by what's called dentate ligaments. They're little ligaments that attach to the dura, which is the insulation around the spinal cord, and they anchor it into the spine. Well, if we take something nice and curved and we straighten it out or pull it forward, it stretches and pulls everything. So it can pull on the muscles, the ligaments, and the tendons on the neck or in the spine, but also on the spinal cord itself can be pulled taut, and that can slow down the neurological signals as well. Okay, now when we're looking at the spine from the back, these little bumps here, these are called spinous processes, but we can just call these little bumps.
Little bit,
you feel them on your back. The little bumps,
the little bumps
they
should
should all
back.
be in a nice straight line, one on top of another. A lot of times when on an x-ray, we'll see, one will be twisted to the side.
So it's all
now, what we can see when we look at the nerves, when we twist it like that, we'll look at one particular nerve. Watch what happens when we rotate.
It gets caught.
See, the hole gets smaller.
The hole gets smaller
and can put pressure on the nerves. There's also arteries, veins, lymphatic vessels, and adipose tissue all coming in this same little hole, and so everything gets smushed together. But the nerves are the most delicate, so they're usually the ones that cause symptoms first.
Now, and I don't know if this takes us on a tangent, but I've heard like of sciatica nerve. Is that something when you talk about a nerve, because I know a lot of times the nerve hurts and it pinches and that, is that same type of situation where it also
that is
getting
exactly
caught?
the same type of situation, and the sciatic nerve is actually one of your peripheral nerves, which means it's not within your spine, it's outside. And what happens is it actually is branches from the lower lumbars and your tailbone. These nerves all branch together to form the large nerve, and that's what runs down and innervates all the muscles and sensation on the back of your leg, and that's the sciatic nerve. There's nerves that go to every single part of your body, so if you can feel it, there's a nerve there. A lot of times people will hear sciatic radiculopathy or sciatica, which is just pressure on the nerves and causes a shooting pain, sometimes numbness, tingling, muscle spasms down the sciatic nerve. But you can also have that in other nerves in your body too. That's just a common one that people are familiar with.
Now, if, for instance, we'll say patient X that we've been talking about came into your office, you did some of those, you might have done an X-ray, did all those other tests to see if there's anything other, major going on. Let's say if we do kind of a common symptom that you see, what might be some appropriate adjustments that might happen?
Okay, so there's several different techniques that chiropractors will use in order to adjust these misalignments in the spine to help correct it, get the alignment improved, and also to help alleviate the pressure on the nerves. Many techniques are manual techniques, which are done by hand, where it's a gentle hands-on adjustment where we're actually just gently pressing the vertebra back towards the proper position, and we'll generally use the transverse processes or the spinous processes, which are the little bumps.
Right.
We'll actually use those little bumps to help shift the vertebra over. And sometimes with manual techniques, you'll hear a little popping sound.
Yes.
Some people, call it cracking.
Cracking, yeah.
It's actually what causes that sound is a release of pressure within the joint capsule, causes gas bubbles to come out of solution. So it's similar to if you were popping your knuckles,
right.
or if you were popping bubble wrap, pop a balloon. Anytime there's gas pressure escaping, you get that loud popping noise.
Okay.
So it's not actually
Isn't that bad?
It's not the
It's
bones
okay,
cracking
it's not
or
bad,
crunching, and it's not bad at all. And it also, when that happens, it releases endorphins and enkephalins, which actually make you feel good. That's where sometimes people will have like a euphoric effect, where they'll get adjusted and say,
well, I feel so
like
much
that,
better.
much relaxed, which is good too.
Now, what happens if, for instance, somebody's, you do that adjustment and they leave, they feel, wow, I feel great, and a week later they come like, gosh, I still don't feel that great. Are there a certain amount of time, does it need to where you have to adjust to get it back into the memory or something that those
Absolutely. I'm glad that you asked that. It really depends on the individual's case. And the biggest factor is how severe the injury is and how long ago it was. Because many times people, they'll wait, they'll say, oh, it hurts a little bit, not that bad, I'll give it, I'll just, put it off, 10 years go by.
Right.
Now they say,
That's
oh,
always
hey, can
bothered
you
me.
fix me? Well, it's like, it's not like I can just fling everything back in place. It's more like, having braces on your teeth, where if you went and saw, an orthodontist and said, I got these crooked teeth, can you straighten them out overnight? No,
Probably
it
not,
just doesn't work that way.
So is there some kind of memory, so to speak, or is there some kind of way that the body wants to go back?
Muscle memory, where the muscles, and I actually have a good model for this too.
Okay.
So on the sides of the vertebra, there's muscles that attach on either side. And when the vertebra gets misaligned, so let's say we had an injury, okay, it hurt, whatever, we left it, we let it heal. Muscles usually heal in about 4 weeks. Tendons can take about 6. Ligaments usually take 8 to 10 weeks. Right. But let's say we had this injury, the vertebra is twisted, and the muscles we had some straining, some micro tears. But we took some Tylenol, we waited, a few weeks later, we felt better, we said, okay, it's no big deal. Well, the vertebra is still misaligned, but now the muscles, tendons, and ligaments are healing in the wrong position.
Oh, I see.
Now, muscle memory, the muscles are used to being a certain length. So when it's twisted like that, the one muscle will heal shorter on one side and the other side will be longer. So when we start to make an adjustment and move it back towards the right position, that muscle is going to be pulled tight, and it's going to actually start to pull back out, and it can actually pull it back out of alignment. And so, we're not flinging it back in place with one adjustment, we're kind of gently pushing it over, and then it kind of pulls back.
Right.
So a lot of times people will have that misconception too. They say, if you see a chiropractor, you have to go all the time.
Right.
Depending, we have several different types of care. That would be more of a corrective care plan, where we actually are battling against this muscle memory, in which case we'd have a higher frequency of visits. So we might see somebody 3 times a week, where we're making a small adjustment, the muscle kind of pulls it back out, we make a small adjustment, so we're kind of doing 2 steps forward, 1 step back, until we can eventually get it lined back up and help retrain those muscles to hold it in the proper position.
Now, when you do adjustments, the other thing, and thank you for answering that, because I think a lot of people think that they have to go every day for, or once a week for a year or something. And again, it could be dependent on an individual case and that, but it doesn't assume that you start from that point. The other thing is when you do an adjustment, when you do, again, this may be unfair because it might be up to, of course, the patient, but do you usually find where you have to do multiple adjustments, that maybe you do the upper and lower back or maybe the neck, or do you find that some interact where you have to do different locations?
Absolutely. Most of my patients don't just have one problem. I have some patients who I'll only adjust their neck, or I'll only adjust their hips. But the majority of patients will have some issues throughout their spine. Oftentimes we'll see, somebody will have a scoliosis where the spine's actually curving like this, and it actually will curve over to the other side to correct, so you're not walking around sideways. So you've got these 2 curves, and usually there's a lot of rotation. So I won't just be working on one area, I'll be working on several areas throughout the spine. But a lot of the time, more than often, people will have problems in multiple areas or several areas.
Now, if there's somebody watching and they may, everybody, they're very sensitive about their back or their body and not wanting to do permanent damage or hurt themselves or become, not able to walk or something, because people sometimes think the worst that whatever happens. What might be cases that they should come to a chiropractor, and one might be cases that they should go to a medical doctor? Is there a way, so if they worry about, the unexpected happening?
Well, chiropractic is very non-invasive. We're not, we're not cutting anybody open.
Right.
It's very rare that anybody is injured at a chiropractor. Sometimes people might be a little bit more sore, but there's not any type of permanent injury.
Right.
However, if you're bleeding out of your head, please don't come to my office.
Right. Yeah.
Go to the hospital. Oftentimes, when somebody's in a severe car accident, they should go to the hospital, get checked out, make sure that there's no fractures or internal bleeding, and then they should get over to the chiropractor as soon as they're cleared.
Right, make sure all that's been taken care of.
Because oftentimes they'll go to the emergency room and they'll be looking, see, is anything broken, are they bleeding, things like that, is there anything dislocated, and then they'll say, oh no, they're fine.
Right.
But that doesn't mean they're fine. They could have severe strain injuries. They could even have bulging or herniated discs, which I can talk about that too.
Sure.
We'll ask me about that later on. We'll go into that some more. But that would be a good time. Anytime, sooner after the injury, the better. Because if somebody had an injury 20 years ago and now we try to work on it, it's going to take longer to fix it, and it's not going to get quite as good as results if we worked on it initially. Like I was saying, like when there's damage, a sprain or strain to the muscles, tendons, and ligaments, the sooner we start working on it, if we can get it lined up properly before it heals, then it's going to have healed in the proper position instead of having to go back,
just like you showed with the muscle memory there, yeah. Now, if people are watching and they're saying, well, I've always wanted to maybe try to go to a chiropractor, but I have no idea who to go to. Is there a place for them to go to find a good chiropractor? I mean, you mentioned a little earlier about some training and that. Is there any kind of place that they can go? And also, is there some questions they can ask? Because it's probably like any doctor. You want to have a good rapport. You want to have that trust. You want to understand, that they understand you and you them. So is there some places they can go to find one? And when they do, what questions they might ask?
A good place to look, well, obviously you could go online and try to find chiropractors close in your area, because if you are going for corrective care, if you're going to be going, several times a week, you want somebody that's in close driving range. So most people don't want to go. I have some patients who drive an hour to see me because they like
because they started with you, maybe how you adjust.
But the majority of patients, are within 20 minutes to half an hour drive.
Okay.
Now they could, like I was saying, go online. Also, different states have state associations which have members, thousands of chiropractors, where that would be a good place to go, and then they can give you a listing of all the chiropractors in your area. Then a few different questions you might want to ask is, first off, which techniques do they do? Now, like I was talking before, manual adjusting, there's several techniques that are in that category, whether it's, full spine, diversified, Gonstead. These are all different names of techniques where they're manual adjustment. There's also many instrument-assisted techniques, such as activator, which is it's a little mechanical instrument that gives a controlled amount of force and just gives a little impulse, and we'll use that to help move the vertebra over. And there's also torque release technique, which is a different type of instrument. So there are several different techniques. So that would be one thing. If you don't want to hear the popping sound, you might want to go someone who uses more light force techniques like an activator. Or if you want a manual adjustment, which then you want to find somebody that does full spine or diversified. So it depends on the techniques that you want. Also, it wouldn't hurt to ask which schools they go to. Just like any doctor, you want to know, where they receive their training. Obviously, you want to make sure they're licensed in the state.
In the state, So those are some good things, because I think those things can help people. Because again, it's a little nervous when you're going for the first time and you're kind of looking online or Yellow Pages, however everybody does it, to try to find a chiropractor. So, now you did talk a little bit about herniated disc. Can you talk a little bit about that? What that means? Because I think people hear the term and maybe they're not taught bulging disc.
So a disc, what the discs are, is a ligament that is in between each vertebra, and it's very dense, very tough ligaments that go in a crisscross fashion, and they attach to the body of the vertebra above and the vertebra below. And so they hold those vertebrae together, and they also keep them from slamming into each other because the inside part of the disc is called the nucleus pulposus. It's mostly made up of water. It's about 80 to 90% water, and then the rest is connective tissue. So it kind of has the consistency of toothpaste or peanut butter. It's kind of like a goop. And so it's like a balloon. It's tough on the outside, filled with toothpaste.
Some fluid inside,
so it's the fluid in the inside. So it acts as a shock absorber, so it keeps the vertebra from smashing into each other. It also increases the height where the nerve is coming out, because the hole is actually made from partly from the vertebra above, partly from the vertebra below, and then partly from the disc. Now, what can happen is, just like any part of our body, we can have an injury to it, is the discs. If we sprain the disc, just like spraining your ankle, you just stretch it, you take a ligament and you stretch it out. Well, there's little microfibers that will tear on the annulus, which is the ligament portion of the disc. And when that happens, it gets stretched out, and that area is going to be weaker. Now, when we have pressure, just our body weight pushing down, is actually going to cause the water part to move to the area that's weakest. So it's
just like a water balloon,
just
or like
if
an area balloon that was getting weaker.
To squeeze a water balloon or to step on a water balloon, it's going to squirt over to the side, to the weakest part. Now, I have a couple models here. I'll show you what that looks like. So on this one here, so this is, you can see here how the disc is bulging. That's a bulging disc. That's called the disc protrusion. And then this here is a disc herniation, or a disc extrusion is the a medical term for it. And the difference is just how severe the goop is pushed out. So if it pushes right up against the wall but doesn't squirt through it, that's a protrusion or a bulging disc. Now, if it actually pops through, that's a herniation. And it can actually get worse if the goop actually squirts all the way out and is floating in the spinal canal. That's called the disc sequestration, and that's bad. That you need to have surgery immediately. But even with herniated disc, it can be managed conservatively in a chiropractic office with adjustments and traction or decompression.
And how do you determine that, through like an x-ray, or what tests can help you tell if it's bulging or herniated?
That's a great question. So you won't actually see the discs. You don't see soft tissue on an x-ray. You'll see the alignment and the bones. Now, to see the disc itself, you would need to have an MRI or a CT. Preferably an MRI is best for imaging the disc. And when that's the case, we'll send them out to an advanced imaging center and have an MRI taken. And when we see a bulging or herniated disc, we'll know better about how to treat it.
What might be some symptoms that people might have to even think they have something like that?
Usually radiculopathy, which is like we were saying, the sciatica. When you have sciatica, that might not just be from the nerve, from the rotation. It could also be a disc bulging or herniating, putting pressure on that nerve, causing that shooting pain, numbness, tingling. A lot of times we'll see bulging or herniated discs in the neck following a car accident from a whiplash type injury. We'll have bulging discs, and then people might have like tingling in their fingers or in their hand, and it might go numb, and also they might have some weakness too. They'll lose grip strength and things like that. Lets you know that there's definitely something that needs further investigation. That's when we'd order an MRI and see if there is a bulging disc there.
Hernia, which is nice to know if there's an opportunity to do that possibly before surgery, because people really want to avoid, I think, back surgery.
That's one thing I'd highly recommend, is start off more conservatively. A lot of people are, they say, oh no, I need to have surgery immediately. If you try chiropractic first and it doesn't work for you, you can still have surgery. You're not any worse off.
It's not going to make it worse.
It's not going to make it worse. You're, whether you have surgery immediately or in a month or in 6 months, you're still going to have the same results. Whether versus if we can fix it through chiropractic, you're going to get better results in the long run if you do get better. Not everybody can get better from just chiropractic care, though sometimes I'll refer patients out to orthopedic or neurologists. But it's always better to start off more conservative. So I'd recommend starting off with chiropractic, and if that's not working, move towards drugs, and then surgery should be a last final option.
You know, we talked about a lot of back issues, but you as a chiropractor, and not to put you out of business, but what would you recommend people to do to have better back health? And I know right now I'm slouching, which probably is a problem, but as a chiropractor, for people to avoid back problems, what might be things they're doing today that they should stop doing or change?
So like we were talking before about these misalignments, which is called a vertebral subluxation, is when the vertebra twists and pinches the nerve. That can be caused from a couple different things. So the main causes are broken down into two categories. We've got what's called macro trauma and micro trauma. Now macro trauma, macro just means big. So it's a big accident.
Car accident.
And that could be a car accident, it could be a sports injury, it could be a slip and fall on the ice, you know, you fall at work. Something that you could have a perfectly healthy spine in 1 second, you fall on your head and everything's twisted and right. So that's a macro trauma. Now, like what you're talking about is more of a micro trauma, which is it's a cumulative, repetitive tasks that we do. And that can be things like our posture, how we sit, how we sleep, how we work. You know, a lot of times people are hunched over a desk. The new term for it is what's called a kyphosis, which is where the neck's curved forward like this. Yeah. The new nickname for this is text neck, because people are looking down. Texting. So you have your head forward, you know, 6 hours a day, you know, whatever. That's going to start to stretch out those muscles, tendons, and ligaments, and it's going to remold the shape of your spine. So we want to make sure that we have good posture. We sit up straight, keep our shoulders back, heads up, right? You know, try not to cross our legs or sit on a thick wall that can cause our hips to
tip to
the side. And you know, and then women with heavy purses, you know, anything that's non-essential.
Computer bags, you know, or you know, even the kids' school bag. You know,
we'll see mothers carrying a kid always on the one hip, and then their hip starts to twist to the side. And you know, those are all things that, as a chiropractor, I'll work on. But it does help to prevent doing it. You know, so stop doing the bad things at home, and I'll fix the damage you've already done. And usually, the people who do that get better results faster, just because they stop messing themselves up.
Well, Dr. Rodnick, thank you so much for being here with us today, and thank you for bringing a lot of these things, you know, where we can actually see what you're talking about. So again, thank you very much for sharing this with us, and I thank you for watching, and I wish you all the best of health. I'm Cindy Caines.